Hi guys, welcome back. Dr. Ilana Gelman here, naturopathic doctor. I'm really excited about this topic. It's all about sleep. And I got this question from a community member, and my heart goes out to you guys who have difficulty sleeping. I know when I even lose a little bit of sleep, my day is completely off. So I really want to touch on two different components of sleep, and that's some people have difficulty falling asleep, some people have difficulty staying asleep, and some people have both. And so I really want to, I'm going to divide these videos. Today we're going to talk about difficulty staying asleep, and next week we're going to talk about difficulty falling asleep. This really is a big subject for me because I'm really always about finding the cause of people's distress and seeing how that really affects them. And I always ask about sleep with every of my patients. And oftentimes, when you have a lack of sleep, symptoms can come up in very different ways. For some people, it can present as headaches. For some people, their PMS gets worse. For some people, they get irritable and depressed. It really kind of affects people in different ways. And so with every patient, it's so important that they get vital sleep and like consistent sleep. And if they're not getting consistent sleep, that's one of the first things that I work on with them. And so if you are suffering with that, then this video is going to be really important. This one and next week's. So since today's topic is about staying asleep, there's three things that I want to share with you guys that could be a cause and maybe could possibly help. So the first thing is that I always think about is I always ask what time people wake up in the middle of the night if they're having difficulty staying asleep. And oftentimes I get the time they wake up is between 2 and 3 a.m. in the morning. Now they could be waking up with anxiety, they could be waking up because of hot flashes, they're postmenopausal, they could be waking up to use the bathroom. Really what it is for me is I want to know what time of day and what's going on with them, and that will help me guide me with what therapy to use. So the first therapy that comes to mind always for me is homeopathy. Now homeopathy is so individualized that it's really difficult for me to just give you quick little tidbits of what remedy to use. You really need to go and see a qualified homeopath to get that particular remedy for you. But the one that I do want to share with you that I do use pretty often, it's called Nux vomica. And this is a perfect remedy if you're waking up between the hours of 2 to 3 a.m. and you're thinking about work. It's the one thing that's on your mind and you're constantly throughout the day even revved up thinking about work, really just hard on yourself because you don't feel like you're like making your mark and your expectations are so high. But a very big keynote, a symptom to give Nux vomica is waking up at 3 a.m. thinking about work. So that may be a good remedy for you, but obviously seeing a qualified homeopath is going to be the best to get that right remedy. Now, the second thing I want to share is that waking up between the hours of 2 to 3 a.m. and sometimes again at 5 a.m., that could tell me information about your cortisol levels. And that's about your adrenal function or dysfunction. Now, we throw around those words a lot, but just to make it very brief, people who wake up between those hours tend to have a cortisol imbalance, meaning their rhythm is off when it comes to their stress hormone cortisol. Now, our natural rhythm is such that when we wake up, our cortisol is high. We're refreshed, we wake up, we need energy, and then as the day goes on, that cortisol gets lower and lower and lower to the point where we're now low enough where we want to fall asleep and we're tired. Well, some people's cortisol will spike in the middle of the night, and then that's what wakes them up. If that's the case, there's a good nutrient out there called phosphatidylserine. That I've been finding people have pretty good help with, along with some adaptogenic herbs. Two which come to mind are rhodiola and ashwagandha. If you want more information, just send me a comment or question or email and I'll help you with that. Now, the third thing I want to mention that I've been seeing really good results with are the vitamin B6 injections. Especially for women that wake up with hot flashes, this seems to be really helping them. And not even just with hot flashes, but waking up throughout the night. I've been really impressed by that. Now, the oral dose of vitamin B6, I haven't seen good results with, but the vitamin injections I've seen really good results with. So that's just another thing to keep in mind. But the take home with this is that it's very individualized. You know, we don't know what's causing waking up in the middle of the night, but it's definitely important to understand what that is for you and then really find either a natural therapy or a conventional medicine, if that's what you feel is appropriate, to really help you with that and figure out what the cause of that is. So that's a video on helping to stay asleep. But next week I'm going to have really good advice with difficulty falling asleep and what you could do to help make sure that transition is easier for you. Okay? All right, well, I hope that was helpful. Please share this with others who are having difficulty. This is so important. All right. Well, I will see you next week, and we will continue this conversation. All right. Have a good week. Bye.